Okay. Hi, everybody. My name is Amanda Brewton. I'm the owner of Medicare Answers Now, which is an FMO out of Cleveland, Ohio. Many of you know me from all of the different trainings and stuff that I do out throughout the country, both in person through my conferences, as well as through my social media, Facebook groups, and LinkedIn, all of that. Today's discussion is on the changes regarding postal workers, which is coming up this upcoming year. And when I saw the changes that were happening, I reached out to a friend of mine that I've known for several years now, who specializes in this space, and she's wicked smart at it. Which most of you all know that I don't put somebody in front of you unless I can tell you that the information that they give is solid and you actually need to know who they are. So this is Nicole Sherwood. She has been working in this space for a hot minute. She educates federal employees and postal workers pretty regularly. And today she's going to school you on how these changes affect you, what you need to know to advise clients that may come across your agency, call you, what smoke signal, whatever that is. I am going to go ahead and record this, so it will be out on YouTube probably a couple of hours after we get done. Please make sure that you put your questions in the Q&A. We will try to answer those at the end, but this way you guys can pay attention to what is being shown and taught over the next hour that we roll. So with that, Nicole, the floor is all yours. You do have sharing capability, so by all means.
Perfect. So thanks for that introduction. I will tell you guys a little bit more about me as well as the agency I work for. I have been in the health insurance and Medicare space for about 7 years now. And 3 years ago, I joined an agency called United Benefits. And 95% of what we do is work with federal employees from the start of their career at their new employee orientation all the way through retirement and post-retirement. So we help with all kinds of benefits for them, education. We do a lot of education around their retirement, their benefits. We do webinars on their open season so they can make elections with information. And when I was brought in 3 years ago, the dilemma was we knew there was a gap in their knowledge and the information they were getting as it related to Medicare and retirement. And I always tell people when I'm talking to them, if a federal employee calls Social Security, if they call Medicare, if they call their health insurance, if they talk to HR at work, they are going to get a variety of different answers on what they need to do and what they need to know as it relates to Medicare. So we went on a search and we scrubbed all of their documents that they get when they join a federal agency. We looked at government documents, legislation. We looked at their summary of benefits. We looked at so many sources to figure out and determine what they're really allowed to do and what they should be doing, because those are two different things, and sometimes they work together and sometimes they don't. And so as we get into this today, we're going to start, before we get into postal reform, talking about federal employee health benefits, because you can't just jump into postal reform without knowing something about federal benefits and how they work and what they're allowed to do as it relates to Medicare, particularly in retirement. So I'm going to share some things through a presentation, and then we're going to go to a website so you guys can pull some things on your own if you're sitting down with somebody that's valuable information. Then we're going to go back to our presentation and talk about the postal reform part of it. So let's get started. Give me 1 minute. I'm getting through all the things to allow me to share. So can you guys see my screen yet?
No.
Okay. It might force me to quit because it's I've not had to share
There
from
we
this.
go. Now it is.
Okay. Okay, perfect. So we can see this, right?
Yep.
Perfect.
There you go. Perfect.
Perfect. So FEHB, that stands for the Federal Employee Health Benefits Program. A couple things to note about that. The federal government is the largest employer in our country, and actually the Federal Employee Health Benefits Program is the largest sponsored health insurance program in the world. So it's huge. A lot of times we think it's just Blue Cross Blue Shield. When I show you some things today, you're going to see it's a lot of other things. It covers over 8 million employees, retirees, and their family members. It was created in September of 1959 and actually went into place in July 1st, 1960. It was administered by the Civil Service Commission, and today that's referred to as OPM, or the Office of Personnel Management. That is a national organization that administers all of their benefits. Can be a pain to get a hold of them if you ever need to, but definitely well worth it if it comes to that situation. An employee has 3 different options. They can just insure themselves, they can insure themselves plus one, or their family. And they are comprehensive health insurance plans. For those of us that work in Medicare and health insurance, we know that Affordable Care Act also affected group plans. So it does, there's no restrictions, no waiting periods, insurance can't quit paying, preventative care covered at 100%, all of that good stuff. When we look at FEHB into retirement, in order for them to keep their federal health insurance, there's 2 requirements if they want to keep them. They have to have had the health insurance for 5 years, and they must qualify for what's called an immediate annuity. That just means that they're eligible to retire. Somebody could have worked for 5 years, but if they just quit their job and don't actually retire, they don't get to keep the benefits. Likewise, maybe they're eligible to retire, but never picked up health insurance or only had it for 2 years. They don't get to keep it. So it has to be both for them to keep their health insurance into retirement. A retiree, just like an active employee, can make changes every open season or if they have a qualifying life event. So whenever I'm talking to somebody about how Medicare works into retirement, I always reassure them, look, you can always make changes. This is not a permanent decision. Sometimes people feel like, oh, I'm retiring, so what I'm doing with my health insurance is a permanent decision, but it's not. They can make changes, whether it's a qualifying life event or during their open season. If a retiree is covering their spouse on their health insurance, or maybe they're not, but they want to maybe have that flexibility later as they're going through the retirement process, they have to choose a survivor option in order for the spouse to keep their health insurance if the employee predecedes the spouse. So some people don't care about that. Some do. If you talk to somebody and they're already retired, they're going to know what they chose to do in that process. If you're talking to somebody and they're getting ready to retire and they don't know what to do, that's where you guys are going to want to reach out to somebody who really understands federal retirement, and you're welcome to call me anytime. So the cost for their federal insurance stays the same while they're retired. So the agency currently pays about 70% of their health insurance premium, and the employee is responsible for 30%. And that's just converted into a monthly premium when they retire. It's taken directly out of their pension check. So most of people who retire, they're going to have plenty in their pension to cover the cost of their health insurance. They don't need to worry about writing a check for that. It just comes out of their pension check. So when we talk about coordinating Medicare with their federal employee health benefits, obviously while they're working, FEHB or their federal health insurance stays primary while they're actively working. Once they're retired and over 65, now Medicare is primary. So if they're actively working, their federal benefits are credible for Part B coverage. The second they retire, that 8-month clock starts just like it would for anybody else on them to be able to pick up Part B with no penalty. So my advice to anybody when I talk to them about their federal benefits is that they should opt into Part B to avoid penalties and save on their cost of care. I am very passionate about this. I can only think of 2 times somebody said, I'm not enrolling in Part B. and they had kind of weird situations, but I still would have told them they should have enrolled in Part B. But by and large, once I go through my spiel with everybody, they're like, yes, I want Part B. I believe in it. I think it's important. I think they don't think long term sometimes if they're not going to take it. And their clock for a penalty starts just like everybody else. That's the key part. So one thing to note about FEHB plans, as well as when we get into the Postal Service Health Benefits Plan, is there are certain companies who started in 2024 offering a separate Part D prescription drug plan. Now, the kind of thing that kind of honestly sucked last year is they enrolled people in this without them knowing what was going on. They just all of a sudden got a new card, all of a sudden went to the pharmacy and didn't know what to do. And they did this because of the Inflation Reduction Act. They said, okay, we're going to have these plans have a prescription D, Part D drug plan that matched what we're going to see in 2025, possibly. So all of these carriers, if they have Part A and Part B, they are auto-enrolled, except in Blue Cross Blue Shield plans, you have to have Part A and Part B to have that. Now, they don't have to have it. That's the key part. They can call their insurance company and say, I want to keep my current drug coverage for whatever reason, right? They have that option to opt out of it, which was kind of a nice thing for them, knowing that they didn't have to take it. And again, it's going to depend on person by person, whether they want that or not. Now, this is where it gets really fun, you guys. So in terms of coordinating Medicare and FEHB, and this will apply to Postal Service benefits as well, they really have 4 options. Option 4, I don't bring up unless somebody brings it up, because I don't think for most people it's in their best interest. So I have this little chart, but we're also going to kind of itemize it out. Like, we're going to look at this. So option 1, they're retired. They want to know, what do I do with Medicare? Option 1 is they're going to take Medicare Part A and Part B. They're going to keep their FEHB plan. In most federal benefit plans, that plan pays everything that Medicare doesn't pay except for their prescription drug costs. That stays the same. Think of it like an old school Plan F for most of the plans. There are some plans that will still have cost sharing with Medicare. If I see that, and I'm going to, what the site we're really going to look at is looking at their benefits and how they work with Medicare, how they work with original Medicare and Medicare Advantage plans, because that's important for you guys to know. If I see that they have a plan that doesn't pay everything Medicare pays, my response to them is, hey, you might want to look at some alternatives during open season that will pay everything Medicare doesn't pay, because those are options. When I start to talk to somebody about their options, if they ask me, well, I don't need Part B, do I? Because they hear that often. And my response is, yes, you need Part B. And I will say the federal government, as your employer, says, look, you can keep your federal benefits and not have Medicare Part B, and we're going to let you keep your benefits. But the federal government, who manages Medicare, says, we don't care what we told you as your employer. If you don't take it when you're eligible, we're going to penalize you. That's the first thing that I tell them. The second thing I tell them is, we're going to show you ways how to offset the cost of Part B. One of those ways is many federal employee health benefit plans actually help you pay for Part B. You want to know what those plans are, because maybe you want to move to that plan during open season if your current plan doesn't offer that benefit.
So I just want to interrupt real quick. Let's make sure that we caught that. If they're still working, are you recommending that they enroll in Part B at turning 65, or do they wait until they retire?
They wait until they retire.
Okay, thank you.
That's always my recommendation, because again, while they're working, their benefits through the government are going to be primary, and Medicare may or may not pick up anything. So they're paying money that they may not need to pay. So just like I'm dealing with any other person who has group coverage, I'm saying wait, especially in this situation, because It's not a situation where I would ever recommend somebody just drop their federal benefits, because then they don't get to keep them when they retire. So,
And then the other question is just that there's a mistake on your slide on your
I'm
slide.
sorry.
The Part B is not 170. So
Oh,
that was last year's amount. So it is the 174.
okay. I typed really fast, so you're going to see that
It's
again, you
okay.
guys. I'm so
It's
sorry.
just that somebody went and asked and said, well, they're paying something different, and because we're talking
No,
about something
that's my
different,
fault, you
I want
guys.
to make sure that it is the same, and we're okay
Yes, it
not to
is.
panic with it.
Yes, that's my fault. I'm so sorry, you guys. Yeah, don't panic on that. They pay what everybody else pays. And like everybody else, they could be subject to IRMA. So no changes there. And you're going to see 170/10 a lot, guys. I'm so sorry. Okay, so part option two. This is my one of my personal favorite options. Is, oh look, I got it right on this one. Okay, we'll see what happens. Okay, so same thing. I say, option two, you can do everything you did in option one. So you have Medicare Part A and Part B. You keep your federal benefits, and you can add to it a Medicare Advantage plan that does not include drug coverage. So think your Humana Honors, your Aetna Eagles, your United Healthcare Patriot plans. Those will function with most of your federal employee health benefits. And I'm going to show you how to know if it's going to function with them. And they can take advantage of the Part B reimbursement in that plan, as well as what's available in their government plan, provided they're not making money, right? They're just going to break even in some situations. And I'll tell you about some of those situations. And you will get people who say, well, I want silver sneakers. I get that a lot. I want to be able to go to the gym for free. And that's a huge perk to them, to not have to pay for dental and vision that they've been paying for, or maybe opted to not pay for. And it works really well. People love it. And again, not a permanent decision. So if later they say, hey, this isn't working for me, right? If there's something that they're struggling with or something they don't like about it, they don't have to keep it forever. And just like anybody else who has a Medicare Advantage plan, they can change it during open season. I'm used to saying open season during AEP, you guys. So if they elect to do this, what happens is, just like anybody else who has a Medicare Advantage plan, their new insurance is going to be the Medicare Advantage plan and their federal insurance. The federal insurance, provided it's a plan that works with Medicare Advantage plans, will pay all of their copays and coinsurance just like they would if it was original Medicare. So if that Medicare Advantage plan, for instance, has a $40 specialist copay, their federal insurance will still pick up that copay. We have yet to have an issue where this hasn't worked, and you will see in the summary of benefits I show you that it is allowed. And I'm going to show you kind of two specific companies that will come up a lot as you're dealing with federal employee health benefits. Option three, anybody in retirement has the option at any point during retirement to suspend their federal benefits. If they decide to suspend their federal benefits, they can do this for three reasons. They enroll in a Medicare Advantage plan that includes prescription drug coverage. So your normal MAPD plans, if they want to go that route, they can suspend their federal benefits. They can suspend their federal benefits if they're eligible for Medicaid or TRICARE for life. If they choose to suspend them, there's a specific form that needs completed, and they can get their federal benefits back during any open season. So they're just putting them on hold. They're saying, look, I want to put these on hold. I'm using this other insurance, and they can get it back during any open season for the federal government, which usually runs mid-November to mid-December. So it's a very low risk alternative if they want to go this route, or specifically, we run into a lot of federal employees who have access to TRICARE. Option four, I only mention this because occasionally I get it as a question. They do have the ability to cancel their federal employee health benefits. Where this comes up, if somebody did quote unquote their own research, that's always one of my favorite phrases, or they had a friend who told them about a Medicare supplement plan. If they really wanted a Medicare supplement plan, They have to cancel their benefits and they can never, ever get them back. Once I say that, they don't want to touch a supplement. And because their federal benefits act like a supplement, in the end, if they're in the right federal insurance program, and if they add that Medicare Advantage plan, they're actually saving money over going this route because now they're not paying for Medicare versus paying for Medicare and a supplement. So I don't bring up this as an option unless somebody brings it up to me. Because I don't think overall holistically, I can't see where it's in somebody's best interest. And most federal employees, they kept their job, they go to work, they even took a job with the federal government to have insurance for the rest of their life. There are people who come to work, doctors who have private practices, and they work at a VA for the last 5 years of their career to have health insurance for the rest of their life. So I don't bring it up unless they do. So now we're going to look at this comparison tool because this is going to mesh some of what I already talked about together. So OPM is a federal site. You do not have to be a federal employee to see it. Anybody can go to opm.gov. You can look at all kinds of different things on here, one of which is their health insurance comparison tool. The most popular health insurance nationally is Blue Cross Blue Shield. The second one is what's called GEHA, which stands for Government Employees Health Association. And if you click on insurance right here, there is this tool right here, which is the FEHB plan comparison tool. And we're just going to put in, I'm going to put in just a zip code in Ohio for the sake of comparison. A lot of these plans you'll see in every zip code, you'll see some regional plans. For instance, in Pennsylvania, they have UPMC. In Ohio, we have Medical Mutual. And obviously, those aren't going to be listed in other states. Your Blue Cross Blue Shield, your GEHAs, your Aetnas, your United Healthcares, those are going to be across the nation pretty much. When you look at this in terms of the enrollee type, I'm always going to choose annuitant because this person is retiring or they're getting ready to retire. When you choose annuitant, it converts the premium to a monthly premium. Federal employees are paid biweekly, so now you don't have to do the math in terms of turning it into a monthly premium. It's already there. This is also helpful for them to see. And I'm just going to click search because I want you guys to see how many plans are really available, that it's not just Blue Cross Blue Shield, but I am going to select 2 of the Blue Cross Blue Shield plans for you to see the difference in them and the conversation I typically have with somebody who has Blue Cross Blue Shield specifically, since it is the most popular. So I'm just going to scroll through this really quick. Look, tons of plans, tons of companies, tons of plans. Just, it keeps going. They have so many options, and most of them don't know why they chose what they chose. So we're just going to look at Blue Cross Blue Shield right now. I know scrolling is kind of wild to see, but I just wanted you to see what all was available. So we're going to look at the basic plan and the standard plan. Those are the 2 most common Blue Cross Blue Shield plans that you're going to come across. When I talk to somebody about what they're going to do with Medicare, one of the first things I ask is, what health insurance do you currently have? And they say, let's say they say Blue Cross Blue Shield. My question is, which Blue Cross Blue Shield do you have? Do you have the basic or the standard plan? So the standard plan is on the left-hand side right here, and the basic plan is over here on the right. These costs, I have not seen them change by state. I've yet to see that happen. Generally, they're the same regardless of where somebody lives. And you can see right here, the monthly premium shows you for the individual person, individual plus one, and their family rates. Right here, there's all kinds of links to look at their summary of benefits, their provider directories, a prescription pricing tool. If somebody says, well, I don't know which one I have, I might ask, do you know how much you pay? Blue Cross Blue Shield is nice because it will actually say on their card if it's basic or standard. So I will ask them to pull out, their card if they have it. If they say, I don't have my card, these codes right here, 104, 105, 106, and 111, 12, and 13, are printed on what's called their leave and earnings statement, which is also their pay stub. It's printed on their pension statement. And so worst case, if they can pull that, you're going to know exactly the plan they have and whether it's individual plus one, or a family plan. This top part gets into the normal stuff we're used to seeing when we look at health insurance, their deductible and their out-of-pocket max. Yes, they have very, very, very low deductibles, but you'll notice their out-of-pocket maxes are pretty in line with what we see in the marketplace, whether it's a group plan or a marketplace plan. Now, here's the section that gets into Medicare. So member cost, if somebody has Medicare Part A and Part B and Medicare's primary, their deductible is waived. You get into all their copays, member pays nothing across the board. The biggest difference between the standard and the basic plan is the standard plan has PPO benefits and the basic plan does not. But right here, this line right here, that's super important. The Part B premium reimbursement, if they have Medicare Part A and Part B, the basic plan will give them $800 a year towards that Part B premium, and that's per person. So if they are covering their spouse, they are both eligible for that $800 a year give back. So if I talk to somebody and they have the standard plan, I can't tell them, hey, you need to do this. I will say you might want to look at this during open season, because the Blue Cross Blue Shield basic plan is going to give you $800 to help pay for Medicare. If they're concerned about network, I let them know that they can check for providers when they're choosing their benefit election to make sure their doctors are in network. The next thing that will come up is, what if I'm traveling? These plans do cross state lines. Now, if you're looking at a regional plan like UPMC or Medical Mutual, obviously if they wanted to stay with those companies, they're going to want to stay with a PPO plan if travel's a concern. But when you look at your other carriers that are nationwide carriers, they cross state lines and transfer to the next state. I personally have a Blue Cross Blue Shield of Alabama plan. I live in Ohio. All of my Ohio doctors and hospitals are in network, just like they would be if I had Anthem here in Ohio. Now, back to that option 2, they have a separate section in all of these plans to say, what if this person has a Medicare Advantage plan and that Medicare Advantage plan is primary? You will see the member still pays nothing for all of these copays. So when we look at it to say, okay, can they do that for real? Yes, they can. It's right here in their benefits to say, look, if you have a Part C plan, we're still going to pick up your copays and coinsurance. And they can still take part in both of those give backs, as long as they're not, I always tell people, as long as you're not making money on it, right? For instance, the Humana plan, I think it's in South Carolina, gives back $140, $150, something like that. So obviously they're not going to get the full $800 from Blue Cross Blue Shield. They'll just get what they're actually paying. So they're going to break even on paying for Medicare. The second most popular company, like I said, is GEHA. And I'm going to show you a couple of their plans because I do want to tell you guys one thing about them. Back to the point of if the client wants a Medicare Advantage plan with their federal benefits. So like I said, GEHA stands for Government Employees Health Association. They only offer benefits to government employees. And when I pull up this provider directory, they are actually using a United Healthcare network. A couple years ago, they were using Aetna's network, and we found this to be true with both of them. Our particular agency, United Benefits, we have a very close relationship with GEHA. We do a lot of work with them and support with them. And you'll see here that, again, if they have Part A and Part B, the member pays nothing. You will also see if they have a Part C plan over here in this GEHA plan, it works just fine. They still pay nothing. Over here, Not so much. That NA says, hey, if they have this GIHA plan, we probably don't want to do a Medicare Advantage plan with it. This is also the plan that gives that reimbursement of $900. And what we know is that United Healthcare and Aetna did the same thing. They call them, their member, as they're approaching 65 and say, hey, do you want to add a Medicare Advantage plan? They designed one specifically for government employees, but we can still offer our own. And in some states, ours is better than what they're offering. So it is a thing that government employees like to have. They like to know that it's an option. And it's all about knowing what plan they have and does that work with their plan. Most of the time, it's going to. So we're going to go back to our presentation because we're going to get into postal reform. Because that's kind of what spurred this, but you really have to understand federal benefits to know what to do with postal people. So
okay, so we're gonna stop real quick right here.
Yep.
Because I need to go ahead and we've got a bunch of questions. And since this is a point where I need to make sure that we've got a solid understanding, I'm going to ask some of these just so that way we have the right stuff.
Okay.
Are there any FEHB or PSHB plans that enrolling in an MA only would negatively impact?
The only way it would negatively impact is like when we saw that example where it said NA, that just means that their federal insurance may not pick up the copays. It might, but it might not. We don't know for sure. The other thing is sometimes, you'll talk to people that are anti-MA or they've had a bad experience, or we know that there could be those loops where maybe they had to go through an extra step to get something approved. I personally am not super negative about that. I always tell people, look, if that comes up, I'm here to help you navigate that process. We're going to work with your doctor together. That's not something that scares me. I don't feel like that's a negative. We know it can happen anytime, anywhere. It happens in group insurance all the time. Okay. So that's not something I feel is negative. Some people might think that's negative. I don't find that negative.
Is it correct that the only way that they get the $800 is if they continue with the federal plan and the Blue Basic, correct?
Correct. So they have to have the Blue Cross Blue Shield Basic. There are other companies who offer that give back. I just showed that specific one for an example. It might vary in amount, but they have to continue the federal benefits and have Medicare Part A and Part B to get it.
Okay. Do these plans include drug coverage? I believe that answer is a yes.
Yes, they do.
Okay. Are there any time limits on suspending the federal benefits?
No, they can suspend forever. They can suspend till the next open season, whatever they need to do.
Okay. Did you say that this information is the same for federal as it is for GIHA?
So GIHA is just a federal insurance program. So yes, the plan designs could be different. So if you talk to somebody who has GIHA, you want to find out what plan they have and see how that particular plan works with Medicare or a Medicare Advantage plan.
The member cost with Part C as primary, where the member pays nothing, is that with the federal suspended? Do they need to file a reimbursement or is it coordinated?
No, that is if they keep their federal benefits. So they have a Medicare Advantage plan or original Medicare and they keep their federal benefits. Member pays nothing in most plans, not all. I've seen some where they might have a 15% share or something. That is not true if they suspend their benefits. If they suspend their benefits, their copay, coinsurance, or whatever is in the Medicare Advantage plan you help them choose.
Okay. Is there a coordination with postal and military or VA benefits?
So that's kind of two separate questions. When we say military, I'm assuming that person means TRICARE for life or TRICARE. If they're actively working and have TRICARE, yes, there's a coordination. If they're retired and they keep their federal benefits and want to keep TRICARE, something's just not getting billed, right? Because if they have Medicare, Medicare's primary, TRICARE and their federal benefits work the same way, so something's not going to get billed. If somebody's comfortable with their TRICARE benefits and they're 65 and they have Medicare, most of the time they're going to suspend their federal benefits and just go through TRICARE because it's so much cheaper. The VA, no. So if they just have VA benefits, the VA doesn't really, they bill some insurances, some non-insurances. Typically, they're just coming to the VA and using their VA benefits unless they're only like 10%. They only, like, if they have a lower credit and it's cheaper to bill through insurance, they will. VAs don't bill Medicare at all. So it kind of depends on if they have Medicare, don't have Medicare,
Okay.
if they're actively working, not.
So why would somebody suspend their federal benefits?
It doesn't, honestly, it doesn't happen a lot. TRICARE is the biggest one I see people suspend their federal benefits for. Some people just don't want to manage multiple insurances. Some people, might, if they say, okay, I'm going to take Medicare Part A and Part B, and maybe they have a high IRMA level, so all the givebacks, they're still going to be paying a ton for Medicare. It
So
might be
it's
more
the exception,
effective.
it's not really the rule.
Yeah, I always propose it. I've only had it happen a couple of times. Just because federal employees feel very, very tied to their federal insurance. They just do, more than I've seen anywhere else.
And then this is my last question, then
Yeah.
I'll let you go on to the next piece of this.
Yep.
I just want to make sure I'm understanding this correctly. They can have their federal plan, and then we would be able to enroll them in a Med Advantage plan, or do they have to get a Med Advantage plan through the federal government?
No, we can enroll them in a Med Advantage plan with no drug coverage if they're going to keep their federal benefits.
Okay.
And honestly, outside of a United Healthcare company, meaning like something like GEHA, who's using United Healthcare's network, there's not a lot of Medicare Advantage options there. Aetna offers one. It's crazy expensive. Last year I had somebody move to it and they already called me and said, I want to go back to what I had set up with you because this is ridiculous. So, yes, we enroll them in it.
Okay. Cool. Go ahead.
Okay, perfect. So, Postal Reform Act of 2022, it was signed into law in April of 2022. The reason they did this, honestly, is they had an unfair pre-funding mandate. So that mandate required the post office to pre-fund health benefits decades in advance. So no other government agency had to do this. The IRS doesn't have to do it. The VA didn't have to do it. Border Patrol, nobody else had to do this but the post office. And it cost them $5.2 billion since this mandate went into effect in 2007. And was responsible of 84% of the United States Postal Service losses. So when we talk Postal Service losing money, we all wanted to blame it on email and paying bills electronically when most of it was they're funding health benefits decades in advance. So another thing that it didn't just affect their health insurance, it ensured a 6-day mail delivery. So it's kind of crazy is this is now law that we're going to get mail 6 days a week. Since 1983, they had to approve this every year in Congress to say, yes, we want 6-day mail delivery. It was always up in the air. It was going to be 5 days or 6. This is now law, never going to change unless we have another act of Congress that we will get mail 6 days a week. The big thing that everybody's talking about in terms of the health insurance world is it created the Postal Service Health Benefits Program. This is still under the Federal Employee Health Benefits Program. It's just a separate, smaller umbrella under this large umbrella of health benefits. This does affect all active Postal Service employees and retirees. It takes effect January 2025. So this year during their open season is when they're going to have their new tool to go look at, their new set of benefits to choose from. This year's open season is November 11th through December 9th. So that's when they're going to choose a plan. The plan options and premiums won't be available till October 2024. So we don't have a lot of heads up to say, here's your options. This is a new enrollment system under the FEHB umbrella. So wherever they went before, which does vary by agency to elect their benefits, the Postal Service is going to have a new system to choose their benefits. All employees and retirees are going to need to select a plan, even if they want to keep their current plan. If they don't go in and manually select a plan, they're going to be mapped to a plan. There's no way to know if the government is going to do this correctly and keep them in their current plan. They could choose something totally random. They could choose something that saves the government a ton of money. They could choose the plan they currently have. We don't know what they're going to do. And whatever they say they're going to do doesn't mean it's going to work 100% of the time. So postal employees and retirees need to select a plan. This will likely, and I say likely because there's not confirmation, but speculation, history would show that these are going to be largely identical to current FEHB plans. Because ultimately, if you think of health insurance, health insurers, if they have a good group of business, they're going to want to continue offering that. It just separates them into a separate set of plans where only postal employees and retirees are enrolled. It controls really the Part B aspect of this a lot and really keeps them separate, I think, largely to monitor cost as they make this change. This change does not impact their other programs, including FEHB, which is their dental and vision options, FSA Feds, which is their FSA plans, FEGLI, which is their life insurance, and long-term care. Long-term care is not available anymore. Some people are grandfathered in, but any of those other elections they make stay the same. This is just affecting their health insurance benefits and choices. In terms of annuitants, when we say annuitant, that is technically what a retiree is called. This does also change the requirements for retirees in Medicare. If they are a current annuitant or retiree and not currently participating in Medicare Part B, they are not required to do so. If they are currently an annuitant and participating in Medicare Part B, they are required to remain in Part B. They can't decide to drop it at this point. And if they retire starting January 1st, 2025, they will be required to enroll in Part B. There won't be an option for them anymore. If they don't enroll in Part B after January 1st, 2025, they can't keep their federal benefits. If a current annuitant is not enrolled in Part B, there is a 6-month window for a special enrollment to enroll in Part B that started in April 2024. If they enroll in Part B during this time, all penalties are going to be waived. So even if they're 85, all those penalties are going to go away. If they were eligible, they would have received a notification letter in March. To opt into Part B, just like before, they would need to complete that CMS 40B form and submit with their notification letter. Their Part B won't start till January 1st. So if they enrolled now in Part B, it's going to start January 1st. And if they didn't receive a letter or misplaced their letter, they can contact the PSHB department at that phone number or email them. In this situation, my advice to people has been, if you're going to enroll in Part B, I would hand deliver those letters to Social Security for the sake of time. Mailing, faxing, doing it online, it just may not happen within the right time frame. And we're fortunate here in Ohio, things seem to get processed very fast. I have an agent out in California. They are 6 months behind. So I'm always like, take it in, get a receipt what you got, that you took it there, so that even if it's not processed on time, you have proof of delivery, you have proof of when it was done, who's the person you talked to, so that if there's a hiccup along the way, you kind of have a paper trail, which I know seems ridiculous in this day and age, but super important. And outside of that, outside of them getting Part B, everything functions just like we talked about in the first segment. So maybe you're working with somebody and they're getting Part B. It's not going to be active till January. You want to say, hey, here's your options. Let's revisit this in January, particularly if they would want to suspend or add an MA plan. As I said in the first part, I'm super big. If I talk to a postal retiree now and they don't currently have Part B and they say, should I do this? 100% yes. I've never said no to that. If they decide to say no after they hear my spiel, that's up to them. But once they have Part B, everything else is just like we talked about in the first part. So whether they're a federal employee or a retiree working for the IRS, or they're the postal service, works the same way, functions the same way, just under a new umbrella. So any more questions?
House if I go off mute or I come back on mute. Okay. Some of these questions are repetitive, which tells me that you
Okay.
weren't listening when she did her presentation. So I'm not repeating myself for the third or fourth time. You can look at the replay. Sorry, but multitasking, no dice. I have a postal retiree who suspended her benefits earlier this year. Will she need to select a plan?
So that would depend on if she wants her benefits back. If she doesn't want her benefits back yet, no. I would, and this is just from history of like when they introduced the drug plans and all of that, I think it warrants a call to OPM to make sure her benefits are going to stay suspended. This is something new, and I feel like or that postal service health benefits number I gave you, I would definitely call them to just double check. I don't think she needs to opt into anything because that would put her insurance back in and then she's going to have to resuspend. But we want to make sure that her suspension is going to go seamlessly into the new system.
Okay. My 100-year-old aunt is on her deceased husband's coverage. So her power of attorney must choose a plan?
Yes. Or they're going to give her one and it might not be what she wants or needs.
Okay. So it seems like this is an SEP for private Medicare MA for January 1 then, correct?
I mean, if they opt into Part B, yes, but I would say that would more so fall under they're new to Part B versus a private SEP.
The letters require them to be mailed to the Wilkes-Barre, PA office. Are you stating that they can be dropped off at the local office and processed correctly without an LEP?
Yes.
Okay. Time frame for getting Part B for a 1/1 ends September 30th. Is that correct?
Say that again.
The time frame for getting Part B, that
Yeah.
SEP that the one-shot election that they have for anybody that is over 65 right now, that SEP ends September 30th, correct?
Correct. Yes.
Okay. Can you take your PowerPoint, fly it to the beginning, and I think it's like the second or third slide in for me.
Yeah.
Yep. Perfect. And then just show that one for me, and then the
Yep.
first one or the one before it. Okay, my understanding is that these letters have been going out and it seems that this is overall a good thing for them. Okay. If they choose not to enroll in Part B, will they get a penalty just like the others?
Yes.
Okay.
So like if a postal retiree, they're already retired, already over 65, and they don't take advantage of this SEP, their current penalty is going to stay with them.
Do you generally recommend retired postal workers take Part B and the federal plan and an MA only, and then they have two give backs offsetting the Part B?
So when I talk to a postal person or a federal employee of any kind, I say, here's your three options. And I go over all three. And I let them tell me what they want to do, what they're comfortable with. 90% of the time, they're going to choose that second option where they have that MA plan. But ultimately, I'm here. This is how I treat my business. I'm here as an advisor. I'm here to educate you. Here's what you're allowed to do. I believe that everybody should know all of their options. So even though nobody chooses option three, I don't want to say nobody, but few where they suspend, I want them to know that it's there. So I present it like, here's your three options. Here's how it works. And 90% of the time, they're going to tell me they want to do option two.
Okay. Awesome. So just to reiterate, if you do not take Part B, then you cannot get the federal benefits as of 1/1/25.
Okay, so I don't know the context of what they're really asking. So if somebody's currently retired let's say they've been retired for 2 years and they didn't take Part B, they get to keep their benefits just how they are today if they don't take Part B. Okay. If somebody decides to retire January 1st, 2025 or after, and they don't take Part B, they don't get to keep their federal benefits.
Okay.
For postal. If they work for any other government agency, everything stays the same.
What was the reasoning? Do you know the reasoning for USPS to pay the late enrollment penalty and encourage people to enroll in the Part B?
Yes, it is going to save them a ton of money to have people on Medicare, because ultimately what happens is if Medicare's for primary, right, the insurance company, it has a less financial exposure and less financial requirements. All of these plans are self-funded, which means they're taking the pool of claims to develop overall cost. And if the federal government is paying 70% of their premium, those costs are going to stay more stable because the claims are lower when Medicare pays first.
Then both MA and MAPD can be enrolled into without suspending. Or does the MAPD require suspension?
MAPD requires suspension.
Can you go back to the screen with your 4 options on it?
Yep.
Okay, guys, whip out your phones and take a picture of this particular screen for reference and save it. It's a really good one. Okay. And any other last questions? Because we're almost at time. Okay. I appreciate you guys taking the time to go ahead and listen. This was extremely informative. Nicole, you did a fantastic job with
Thank
this.
you. Thank you.
I will probably ask you back to go ahead and do this again for me at some point.
No problem.
Y'all, if you do not if you're not connected via Facebook, connect to Nicole. She is on Facebook. She is in my Facebook groups, which is Ms. Medicare, Marketing and Motivation. She's also on LinkedIn. So you can stalk her that way and get to know her. She's also been at several of my conferences, where you can actually connect with her live and in person. But now I think that you guys can see why I asked her to come and present to all of you. Which, given how fast my chat just blew up, I think you're a hit, Nicole. So
Thank you for having me.
appreciate
Really, it's
that.
an honor.
And guys, have a great afternoon. I will get this loaded as soon as I can so that way you have it. And I'll talk with y'all soon. Thanks. Have
Thank
a good
you.
one.